The coronavirus vaccine arrives, but so does a logistics puzzle for the ages. How do you manage a limited supply of a medicine everyone needs? And what about those who don't trust that medicine? Are they right to wait, or do they need to be convinced to jump in? Today is Sunday, December 20th, 2020, and this is Flashpoint. Hi, welcome to Flashpoint and Merry Christmas as we head into one more big and yet quite unusual week. Chances are you're waiting for some cards or some packages to arrive because the mail has been overwhelmed this year. But to many, the most important deliveries came through last week, and those were the first shipments of the Pfizer coronavirus vaccine. They haven't come in time for so many people. Thursday, COVID claimed Sheriff Benny Napoleon, a man who basically spent his life serving Detroit. Benny died after we taped the upcoming conversation, so I would urge you to head to clickondetroit.com for the many remembrances and tributes to Benny Napoleon. His loss is yet another reminder of the damage this virus has done in communities of color. And yet, we began to see this past week, not everyone is ready to roll up their sleeve. Skepticism is generally healthy, but what's reasonable when it comes to public health? History shows us there is very understandable hesitance, if not outright cynicism, over government medicine in the African American community. But after Nation of Islam leader Louis Farrakhan this week referred to the vaccine as toxic waste, worries began to mount about the task ahead with getting vaccine help to the communities that have already been the hardest hit by the pandemic. What about you? Are you up for getting the vaccine as soon as it's ready? Do you want to wait a few weeks? A few months, a year, or are you a never needler? Marrying our own choices with the demands of public health today on Flashpoint. Well, the vaccines are coming, but just imagine the task of trying to send a piece, say, of mail to every single American, much less something as complicated as a temperature-sensitive 2-dose vaccine. Let's talk about getting everyone into the tent with Dr. Janae Khaldun, the state's chief medical officer, and Denise Fair, the chief public health officer for the city of Detroit. Dr. Khaldun, let me start with you because you got the vaccine on Thursday, which I guess says a lot to me about your level of confidence with what this vaccine can do and its safety.
That's right. You know, I've had the honor of working on the front lines in the emergency department throughout this pandemic. And I certainly understand what toll this pandemic and this virus has taken on patients, but also on our frontline healthcare workers, from our techs to our nurses, our doctors, our staff, both physically and mentally. I've even had 2 clinicians who helped train me in New York City actually died from this virus. So it's been an honor. As a frontline healthcare worker, I did receive the vaccine, and it's certainly something that I encourage other healthcare workers to get as well.
We want the healthcare workers to get it first, Denise, but the question that I know that I'm getting all the time has to be the one that you're getting all the time. How will everybody else be getting it? What are you telling people when they say, when can I get the vaccine?
Sure. So we're going to follow the state's orders. And so there is a phased approach. Most of the population won't get their vaccine until late spring. But our goal at the health department is to provide information so that Detroiters know what decision they should make for themselves. Now, I know I will be getting the vaccine as well when the time is appropriate, and not just for myself, but for my family as well as for my community.
Dr. Khaldun, talk then a little bit about how you're prioritizing. I think we all understand the fact that frontline healthcare workers who have been so heroic through this whole thing, that they need to be first. But then it starts to get complicated pretty quickly, doesn't it?
Yeah, we are following CDC recommendations for how we are allocating the vaccine across the Michigan population. And so we have several phases. I think it's important to note that the phases are running in parallel. So it's very likely that one phase or one group may not be entirely complete before we start with another group or another phase in the priorities. And so absolutely, first, we're starting with frontline healthcare workers, emergency department departments, ICUs, medical floors. And I think it's important to understand it's not just because those individuals are taking care of patients with COVID and maybe at risk of getting the virus themselves or passing it to others. It's also about making sure our critical healthcare infrastructure is well so that they can come to work and they can take care of patients who have COVID or non-COVID concerns. So that's the first group. Then again, depends on how much vaccine we get. We will extend that to people living and working in long-term care facilities. Then we'll expand out to our essential workers, onto others who are at higher risk for severe COVID-19 illness, so the elderly or people with underlying medical conditions. And then hopefully by late spring, we can have the vaccine be available for the general public. But again, a lot of this depends on the supply that we get from the manufacturer.
In fact, Cranes reported this past week that Michigan was going to be seeing a smaller supply of the vaccine in the second week than we got in the first. I suppose there's going to be just a natural ebb and flow of this, just the way that a supply chain works, right?
Absolutely. This changes literally by the hour. We've always said that this is an estimate. We don't really know how much we're going to receive, quite frankly, until we actually know that it's been shipped. And so it's going to continue to evolve. And yes, we did just recently, even last night, get information that the initial estimate for how much we were going to get in the second and third weeks, again, through December, was smaller than what they initially had estimated for us. Yeah. But it continues to evolve.
Well, I want to make the turn now with both of you into this vaccine will only be as good as the number of people who are willing to get it. That's kind of how this sort of community immunity will work. Denise, when you hear somebody like Louis Farrakhan call this vaccine toxic waste, and I know you're already hearing from pushback from some members of the community who just aren't all that eager to be first to sign up, what do you say?
Sure. So let's just talk about the issue of vaccine hesitancy. And we're seeing that particularly in communities of color. It's a natural response, I believe, to have a little bit of fear about something that's new. You think about the city of Detroit, we were hit hard early on.
Right.
We definitely were challenged. However, if you just take a look at where we are right now, we've made a lot of progress. And I do hope that people will take the vaccine. From what we know, it saves lives, but we can't neglect what we already know that works, which is wearing our mask, washing our hands, avoiding crowds, and really doing our due diligence, again, to protect ourselves and for our families. My goal is to share information based upon what has been given to me by the CDC, as well as the Michigan Department of Health and Human Services. We are not going to push vaccines on anyone, but we do want them to be informed so that they can make the best decision for themselves.
Dr. Khaldun, let me let you weigh in on the same matter here. And to this idea of we're not going to force vaccines on everyone, do we get to a point where those who aren't willing to get it have to somehow be excluded from certain things? Or we start bumping up against a real personal freedom and personal choice issue here against the demands of public health, don't we?
You know, at this point, we are not considering at the state level mandating the vaccine. I think as Director Fair mentioned, it's most important that we get information out to the public. I think everyone has a right to ask questions. And quite frankly, I think in communities of color, they have a right to have some questions about the healthcare system and racism in the healthcare system and how it has impacted communities of color. But I also think it's important that we understand the facts about the virus. People get information, can ask their questions, but also I think communities of color have to understand that this is a tool. And if we see that there are disparities as far as who is actually wanting to get this vaccine, the disparities we've seen and the death that has devastated communities of color is only going to get worse. So I do hope that our communities get their questions answered and then hopefully feel comfortable with getting this vaccine so we can fight this pandemic back.
Denise, to talk about the settings that I suppose at a certain point this is going to end up being about local control and every local municipality having to decide how they're going to distribute this. When it comes time for people like me or other citizens to get this, where will we be going? A doctor's office? Are we going to work? Do I go to someplace like the TCF Center? Where do I go?
Sure. So our goal is to make sure that everyone who wants to get vaccinated can get vaccinated. And right now, there's an entire team of employees who are dedicated to developing a plan that works. In fact, we're going to launch the most efficient plan in the entire country, led by Mayor Mike Duggan. And our goal is to vaccinate about 5,000 people per day. We will have information available on our website, which will tell people where they can go. Traditionally, we will, at the health department, we'll get a very large allocation, and that'll be distributed to pharmacies, to local providers, to hospitals, to FQHCs. But again, everyone who wants one can get a vaccination.
And Dr. Khaldoun, as you try and spread these vaccines then out across the state, is it a matter of where the population is? Is it where the hot spots are? How do you make the decision then about how soon Denise Fair gets her share?
So again, it all depends on the allocation we get that is determined at the federal level, but we're going to be using a lot of things, including the social vulnerability index. So essentially it looks at things like poverty, employment, things that really impact how people experience health and are able to obtain optimal health in the community. So we will be using that similar to how we located testing sites across the state to allocate vaccines as well. But every part of the state will have access to this vaccine.
Dr. Janae Khaldoun, Denise Fair, we wish you all the best on this terribly important rollout. Thanks so much for spending some time with us today on Flashpoint.
Thank you.
You bet.
Thank
Merry
you.
Christmas to both of you. We'll take a quick break. We'll back with more. We'll continue to talk about the reluctance of some in the community to be first in line for the vaccine. This is Flashpoint on Local 4.